Hello, my name is Jonathan AMOAH, Group 16 Seed Faculty, Fifth Course, and today my topic is sickle cell anemia. And there are two reasons I chose this topic. First, because as an African descent, I really need to know about it. And a second, the second reason you will know at the end. So, sickle cell anemia, we're gonna look at the definition, signs and symptoms, the complications limited to it, the main syndromes that you can see about this, as well as the management and also prevention and also some treatment. Basically, not really any treatment, but like how to manage it, how to prevent further crisis and all. So let's get right into it. Let's see. Sickle cell anemia is an autosomal recessive disorder which causes production of an abnormal beta globin chains. So, what happens is an amino acid substitution in the gene coding for beta chain. That's amino acid glutamic acid exchanges valine at the position 6. So, what happens is there's an exchange of glutamic acid at valine's position at 6, and this results in production of HBS rather than HBA. And so there is production of hemoglobin S rather than the normal hemoglobin A and hemoglobin F that was supposed to be produced. So there's an abundance of hemoglobin S rather than A and F, even though there is still production of hemoglobin A and hemoglobin F, but it's not abundant as it should be. Hemoglobin S has rather actually taken over the places and is produced more than this hemoglobin A and hemoglobin F. So as you see, HbA2 and ABF are still produced, but hemoglobin F takes more. Okay, so it is more common in people of African origin and the homozygous, that's SS, has sickle cell anemia. Yeah, so because it's an autosomal recessive disorder, you actually need two genes, two traits, two genes from one from mom and the other from dad to be able to get this sickle cell, to be able to manifest some symptoms, to be able to show some symptoms. You need a gene from one from mom or from dad to be able to. But there are heterozygous as well, and these people actually shows no disability because since they are heterozygote, but they have an advantage though. They are protected from falciparum malaria. Falciparum, it helps them protect them from falciparum malaria. But as I said, there's an exception to every rule. There's an exception. Yes, they are. It's true they are protected from falciparum malaria, but in cases of hypoxia, let's say in an unpressurized aircraft or due to in a anesthesia, this the vaso-occlusive crisis may occur in heterozygote as well. And also, if heterozygote uh, has other HBS, hemoglobin, other hemoglobin variants like HBSC or even beta thalassemia together with their heterozygote gene, then they can still show symptomatic sickling. So there is an exception to every rule. So basically, all those of African descent, if you're from Africa, you really need a sickle cell test pre-op just to be, safe because some people actually found out late. And as I said, symptomatic sickling occurs in heterozygotes with genes coding other variant HBA variants like HBC relate to HBSC or beta thalassemia trait leading to HBS or beta thal. So if you are heterozygote for sickle cell with HBAS, but still have other genes coding for other trait like HBC or beta thalassemia, then they can still be symptomatic. So we need to check that. So let's see the pathogenesis, what actually happens. So HBS polymerizes when deoxygenated, and which this causes the RBCs to deform. And this process is actually reversible. So when there is no oxygen, the polymerization occurs, but when there is oxygen, it can go vice versa. It can go back as well. So polymerizes when there is reversibly when deoxygenated, and this form a gelatinous network of fibrous polymers, and that stiffens the RBC membrane, increase viscosity, and cause dehydration due to potassium leakage, and even there is a calcium influx as well. So this the polymerizes actually causes RBC to form, and the deformation is the one that produces the sickle cell shape. That's where the name comes from, sickle cell. And these sickle cells are rather unfortunate. They are fragile and hemolyzes so easily. And normally, the lifespan of RBC is supposed to be, 100, But with this sickles, hemoglobin actually, the the lifespan is like within somewhere 18 to 20 days. So it's rather unfortunate. It's fragile, hemolyzes very quick, and also causes more problems. It broke the small vessels, so there's not enough blood going through some places, and this causes a lot of trouble. As we know, blood is very essential to all part of the body, no matter how small. So that's what happens briefly about that. So let's go into some signs and symptoms that we see with this sickle cell. So, first and very common, the vaso-occlusive painful crisis. That's called painful. It's written painful for a reason. So, it's very common and it's due to microvascular occlusions. So, what happens is intermittent episode of the vascular occlusions, especially in connective tissues and musculoskeletal structures. They produce ischemia, which then manifests as acute pain and tenderness, and it's often affect the marrow, which causing very severe pain triggered by cold, and this is triggered by cold, dehydration, infection, or hypoxia. So it's some of the triggering, and there's hand and feet are also affected if less than 3 years old, will lead to dactylitis, and this can also be called a hand foot syndrome, which is caused by painful infarct of the digit and dactylitis as well. As we said, occlusion may cause mesenteric ischemia, and this mimics an acute abdomen. There is also a CNS infraction, which occurs in 10% of children, leading to stroke, seizures, or even cognitive deferred. Also, a vascular necrosis, example of the femoral head, like there is a leg ulcers, and also low flow priapism. This is very serious. This can also lead to even an impotence, but it may respond to hydration, alpha agonists such as phenylephrine, or even aspiration of the blood and irrigation with saline. So if you be able to get this within like more than 12 hours prompt, it helps prevent impotency. So as you say, it may respond to hydration, alpha agonists such as phenylephrine, or aspiration of blood and irrigation with saline. But if for more than 12 hours prompt, cavernous spongiation shunting can prevent later impotence. So it's very serious, can lead to impotence. Mhm. Next, we see a plastic crisis, one of this crisis linked with sickle cell aplastic crisis. And this is actually due to infection for parvovirus B19 with sudden reduction in marrow production. So this parvovirus, when infected, causes a lot of damages, plastic like anemia crisis. So you can see aplastic anemia in sickle cell patient, and especially RBCs. Yeah, they use is self-limiting, less than 2 weeks, but transfusions may actually be needed for this as well. So, with a plastic crisis, when there's a plastic crisis, then it calls for transfusion. Next is sequestration crisis, and this is mostly linked with splenic sequestration and very common, and with sometimes liver as well. So it mainly affects the children as the spleen has not yet undergone atrophy. So with this repeated microinfarction can destroy tissues having microvascular beds prone to sickling. That's splenic function is frequently lost within the first 18 to 36 months. As I said, it's mainly affect children very early in life, 18 to 36 months of life, and this even cause susceptibility to infection. And a very common infection you see here is pneumococci. So a very acute venous obstruction of the spleen may even occur, and is very rare occurrence in early childhood, but may even require emergency transfusion or even splenectomy. So it's very serious here. And there's pooling of blood in spleen or liver with organomegaly, where the organs become big, severe anemia and shock, and urgent transfusion is needed, as said. But some of the sequestration crisis also occurs in other places, especially in eyes. Occlusion of the retinal vessels can, which produces a hemorrhage, neovascularization, and even eventually may lead to detachment. And also in renal papillary, there might be necrosis, invariable produces isotenuria, and it might lead to a widespread of renal necrosis, which causes renal failure in adults. And this is even the most common cause of late death in the common late cause of death in might have. And even in bone and joint ischemia can lead to aseptic necrosis, especially for femoral or humeral hairs as well. Let's see the next signs, and we see here acute chest syndrome is pretty serious. So, results from pulmonary microvascular occlusion is a common cause of death. That's very common. So, well, what happens is a distinctive manifestation and is characterized by chest pain, tachypnea, fever, cough, and arterial oxygen desaturation. And this can even mimic pneumonia, pulmonary emboli, bone marrow infarction, and embolism, as well as even myocardial ischemia, and sometimes lung infection or in situ of lung infarction. That's a cancer in lung. So it's thought to actually refer to in situ sickling within the lung, and this produces pain and temporary pulmonary dysfunction, and it's very often difficult to or is even impossible to distinguish among other possibilities. So with this, the most underlying cause or concomitant disease you may see is pulmonary infection and pneumonia. So, but as you said, it's the most common cause of death with mortality rate up to 10%. So repeated episodes of acute chest pain or chest syndrome will actually correlate to reduced survival. So it's very, very serious. Okay. And even a reduction in arterial oxygen saturation, especially ominous, because it promotes sickling on a massive scale. So acute chest syndrome is very, very important. Okay, and let's see the tests or the tests that can be done. So, since hemolysis is variable, it depends on how severe. There might be an HB of 6 to 9, depending on how severe it is. HB of 6 to 9 gram per deciliter. There might be an increase in reticulocytes up to 10 to 20%. Increased bilirubin as well may be seen due to hemolysis. There might be increased bilirubin. And on the film, you might see sickle cells and Tagel cells as well. There is sickle solubility test, which has to be positive to confirm the diagnosis, and but does not distinguish. Yes, with this, it does not help distinguish a homozygote from heterozygote. So you actually still need uh, something else to distinguish that. We'll see about that. So it should be positive, that's sure, but it doesn't help you distinguish homozygotes and heterozygote. But to help distinguish that, you need hemoglobin electrophoresis, and this helps actually confirm the diagnosis and help distinguish the homozygote and heterozygote states, and even other HBE variants, as we said. That's when you are heterozygote for sickle cell, but I also have other HB variants like HBC, HB, the thalassemia, beta thalassemia as well. So this is what you can know. Then you know you might be experiencing symptoms of that as well if you have both. So other HBS variants can also actually be help distinguish through hemoglobin electrophoresis. And there are actually other things like the history, the morphology of the RBCs, there is a mass spectroscopy, and sickling tests might also help. So let's go into the complications, some of the complications we see. So splenic infarction, as we said, increases susceptibility. So splenic infarction, which occurs before 2 years old, yes, it occurs pretty early, well, within the first 18 to 36 months of life. And with this, the splenic function is frequently lost, and this increase so leads to increase to susceptibility to infection, and 40% of childhood sickle deaths are caused this way. So it's pretty serious, because since the liver function is the splenic function is frequently down, infection is allowed, especially pneumococci, and it might cause a very, very severe childhood illness, and even lead to death. And 40% of childhood sickle cell lead to death caused by this way. So it's pretty serious, but a zinc supplements may help with that. So poor growth may also occur as one of the complications. The renal failure may also occur, and basically there is renal papillary necrosis, which produces acetonuria, and the renal necrosis leads to the renal failure, and it's a very common in adults, and it's also a late cause of death. And there may be seen gallstones and as well as retinal disease. And what happens here is there is occlusion of retinal vessels, and it can produce hemorrhages and neovascularization and even eventual detachment. And this uh, actually is very troubling. And we see, in case of too much transfusion or repeated episodes of transfusions of blood, there might be iron overload or what we call the blood-borne infections. So Transfusions, although helps in a plastic crisis, but after repeated episodes, it might need it might cause or lead to iron overload or blood-borne infection, and that's pretty serious. So we need to actually do more tests on the blood you get, and also, if possible, limit the transfusions if there are other possibilities instead of always doing transfusion, and this will help limit that. Okay, and let's go to another complication we might see is lung damage. And the lung damage, as we said, when it's polymerized, be due to the hypoxia, it can lead to fibrosis, fibrosis, and also lead to further pulmonary hypertension. And this can actually be partly prevented by intensive spirometry of 10 maximal inspirations per 2 hours. Every 2 hours, 10 maximal inspirations can help prevent lung damage or the hypoxia fibrosis and leading to pulmonary hypertension. So this helps reduce that or prevent that. Okay, let's see for the management, because there's no really a treatment. We just do with the symptoms as it comes. We just manage them. So broad spectrum antibiotics for infection, which is due to the splenic sequestration, as we were saying, they are increased, so they are more susceptible to infection. So to help prevent that, you may need broad spectrum antibiotics, and the drug of choice might be cephalosporins, third generation, which is ceftriaxone as an option, kind of helps. Then also you might use analgesics and IV hydration for vaso-occlusive pain crisis. So the management of an acute pain crisis includes the hydration, vigorous hydration, very necessary. And also for aggressive analgesia, it might be administered by standing or even with a patient-controlled analgesic pump. It can also help. And morphine should also be used here to control the very severe pain. And a very bone marrow pain may also respond well to ketorolac, and helps. And there is also an addition of inhalation of nitric oxide, but this help is very short term. It just provide a very short term pain relief. But with this, there a very great care must be exercised to avoid hypoxia and even further respiratory depression if you are opting for nitric oxide. So you should be careful of that, because nitric oxide also elevate O2 affinity and reduce O2 delivery to the tissues. That's oxygen delivery to the tissues. So you need to be careful if you're opting for that. But in the meanwhile, just a short-term pain relief anyway. So sometimes the transfusions, as said, in a plastic crisis and other crises, sometimes transfusions may be needed, but repeated episodes might comes with its own problems, like as we said, iron overload, or even blood-borne diseases. So should be careful with that. But it helps, but not too many repeated episodes. There is immunizations, especially against pneumococci and Haemophilus influenza, that helps. There is folic acid supplementation and hydroxyurea. And hydroxyurea should actually be considered in patients experiencing repeated episodes of acute chest syndrome, or even with more than 3 crises per year, which require hospitalization. So using hydroxyurea actually helps reduce incidence of other complications as well. Complications like priapism, retinopathy, It helps, but those urea has its own side effect for a very long term side effect. So it's actually uh, under still under, but it still helps anyways. It helps a lot. There is bone marrow transplants, which can be creative, but it's very controversial at this stage, as said. But it's also it's very distinct, definitive cure, but it's actually also known to be effective and safe only in children. So we actually there's also it's controversial, as we said, it's controversial at this stage. So still be looking at and. With it, we can actually manage sickle cell at home, but like in the light cases, not very severe cases, you can just do your basic hydration and stuff. But nevertheless, admissions may still be needed. Example, in cases like hemoglobin less than 5 grams per deciliter, or WCC, that's white cells less than 5 or 30. And also when in fever and temperature of more than 40 deserves admission. Severe pain, when there's severe dehydration or even lung infiltration, you need admission. And there are other options such as gene therapy for sickle cell which is being intensively pursued, but no safe measures are currently available, so they are still looking into that. And before there was an anti-tumor drug called 5-azoxytidine, which was the first agent found to elevate hemoglobin F. So this was actually good because instead of producing too much of hemoglobin S, this 5-azoxytidine helps increase rather HbF. So although the HbS is still being produced, the hemoglobin S is still being produced, but hemoglobin F is also produced abundantly. So it actually helps reduce some of these complications and crises that we've been seeing, but it's never achieved widespread use because of concerns of acute toxicity and also carcinogenesis. So uh, were not actually accepted, but it can be used in low doses. So, or related agents like 5-deoxyacetylene called decitabine, and it helps elevate hemoglobin F. With that, with it related agent with the decitabine, there is also toxicity, but it's more acceptable. Like it's more harm to prevent other complications. We can accept that. Yeah. So that's that. And let's see the prevention, guy, because there's not really a treatment for now. So the better thing is to prevent that. And what do we do? Genetic counseling, especially if we're from African descent. If you're an African, love is not enough nowadays. Love only is not enough because the the child you're gonna give birth to also matters. So love actually is not enough nowadays, especially if you're from African descent. You need counseling even before marriage. Do tests. Go and see. Hey, go and check. Is my wife, is my partner, is my husband to be a heterozygote for this? Am I heterozygote for this? Sickle cell? Is any one of us homozygote? Can it be transmitted? Can it be, you know, passed on to our children? You need this genetic counseling to help, and this will even help prevent any further complication that might come out, and even also save you from further money spending and all the crisis, all this agony. And it helps save the child as well. So you need genetic counseling. Let's say you didn't do that before marriage, still there's no harm. Prenatal test before pregnancy, even before deliveries, before anything you need to test to know is there gonna be a problem with this child? Does this child have any sickle cell, any thalassemia, any heterozygous forms that can manifest or that can show sickling? So you need that as well. And parental education also help. How to issue patients parents should be uh, educated on how to manage some certain crisis as it comes, especially the sequestration crisis, since it's very serious and since it's more susceptible to infection. They are more susceptible to infection. Parents are supposed to be educated on how to prevent such things and how to the use of broad-spectrum antibiotics, how to even prevent the children from getting all this infection, and this can actually help prevent 90% of death from sequestration crisis. So the parental education, circling, the tests, the counseling is very needed since there's no actually major treatment. So it's the only way we can help, especially counseling before marriage is very, very, very useful, guys. Very, very useful. All right, and so thank you for your attention. And the other reason I said the reason behind choosing the topic, the other reason being in memory of my friend Kofi Amenia from who passed away recently due to sickle cell. Uh, in the first February, it was complicated with acute chest syndrome, and he had severe dyspnea as well as sepsis. So may so rest in peace. Thank you, and thank you for attention. Do have a great day.